Everyone, my name is Megan, and today I'm going to talk to you about how to do CPR. Before we get started, I'm going to explain some of the things I'm going to be using in my video to help you understand what's going on a little bit better. So for the purposes of my video, the bear is going to serve as the patient, because if I did it on an actual human, it actually hurt him pretty bad. And then we're going to have a face mask, which comes in a case kind of like this, a little bit triangular. And inside the case is your mask. You're going to have to pop it open when you get it. It's going to look like this. It's going to have a pointy end for the nose and a round end for under the mouth, and that's going to have this valve that you're going to attach onto it. So it's one way so that you can breathe in, but anything on the inside can't con at you if they were to vomit or something like that. And then also in the case of CPR, you would also want to get a device called an AED. And it's roughly about this big of a square. It'll come in a pack. They're on the walls just about everywhere. It'll be a big case. It'll be an emergency case. Probably is going to sound an alarm if you open it, but that's okay. If you need it, you need it. And then when you open it up and turn it on, it's going to give you step-by-step instructions on exactly how to use it and walk you through step-by-step what to do, when to do it, and what it's doing as well. Now, the purpose of this AED is that it's going to analyze the heart rhythm that the patient is or isn't in, and then advise or not advise shock or continued CPR depending on what it senses. So it's pretty cool, and it's very helpful in having a successful CPR. So now you might want to think about, why do I need to know CPR? So I want you to think about this for just one moment. You're walking through the park on a Sunday and you hear someone screaming for help. They sound completely mortified, like everything's ending right now. So you rush over to see what's wrong, and you see someone lying on the ground, they're not breathing, and they're not moving. So you decide they probably need CPR. So in this scenario, do you want to be the person that can potentially save their life and perform CPR? Or do you want to be one of the bystanders standing on the sidelines, not being able to help? Me personally, I want to be able to help, so that's why I know CPR, and I'm going to help you guys learn CPR as well, so you can be the people that can help. So the first thing you want to do when you think someone might need CPR is you're going to go over to them and give them a little bit of a shake and say, hey, are you okay? They don't respond to you. So you want to get nice and close to their face, see if you can feel them breathing on your cheek, if you hear them breathing, or if you see their chest rise and fall. You get nothing. The next thing you want to do is check for a pulse. You're going to take 2 fingers, put them together, and you're going to feel roughly right here on their neck. So I'll do that for about 5 seconds. You get nothing. So then you're going to immediately start your chest compressions. While you're doing this, you want to make sure you specifically point to someone and have them call 911 and have somebody else go get you the AED. So with these compressions, for an adult, let's say, you need to make sure that you're compressing roughly 2.5 inches each time, and that you're delivering 100 to 120 compressions per minute, which is equivalent to the beat in the song Staying Alive. So you want to do 30 of these, and then you're going to give 2 breaths. So 29, 30. For the breath, we're going to open their airway, and go under their chin and on their forehead. We're going to open it up, put our mask on, remember, tip at the nose. Do the EC clamp to get a good seal. So you make an E with your fingers, and then a C with these fingers. The E goes under the chin, the C goes by the mouth. And then you want to give 2 slow, even breaths to make sure that they're not too forceful to pop a lung. So it's a good idea to stop breathing when you see their chest go about as high as you think it would normally go. So it's a little something like this. And then you start on CPR again. Now, in the case that someone gets here with the AED, you want to make sure that you're doing compressions as much as possible, and that compressions are interrupted as little as possible, because that's a main driving force upon a successful CPR situation. So while you're doing CPR, you want to have someone open up the AED, turn it on, and then again, it's going to give you step-by-step instructions on what to do. So it's going to say, apply the pads. One goes right here, and then one goes right here. But there'll also be pictures on the pad telling you exactly where to put it. Then it'll tell you attach the connector, so that's when you put the cords out of the pad into the AED. Then it'll say something like analyzing heart rhythm, do not touch the patient, halt CPR. So you give it a minute, and then it'll tell you shock advised, charging, like clear the scene so no one's touching them, and then give the shock. So you'll press the button on it that says shock, it's going to light up for you. Or it'll say no shock advised, continue CPR. And you keep going, and it's going to keep talking to you and telling you what to do. If it wants to analyze again, if it wants to shock again, it'll keep telling you what it wants to do. and you just keep listening to what it says. So now in the case that you have a child that you're doing CPR on, which is someone the ages 1 to 8, it's the same thing as for an adult, but you're only going to use one hand. You're still going to put the heel in the spot and pull your fingers up, but you're going to do one hand for compressions. And you're going to do the same rate at 100 to 120 a minute and 30 compressions to 2 breaths. The same thing. Now for an infant, it's a little bit different. An infant is anyone under the age of 1. So what you're going to do is you're going to take 2 fingers this time, these 2 fingers, and you're going to put it in the same spot, and you're going to go down roughly 1.5 inches depth, whereas the adult was 2.5 and the child was 2, the infant is 1.5. The same rate, 100 to 120 a minute, and the same breath ratio. But again, just remember, you want to watch their chest rise and fall because an adult needs more air pumped in, where an infant's going to need a lot less air pumped in, and you want to make sure you don't puncture their lungs. So, and then soon your 911 help will arrive and they'll take over care from then on out. But that's what you can do in the meantime to give successful and effective CPR. I hope you guys were able to learn CPR today, and if you ever have to use it in the future, I hope you feel confident that you can make a difference in that person's life potentially and potentially save a life. Thank you.